Okay, hello guys. This is my first YouTube lecture on longitudinal tooth fractures. So, according to 2016 version of American Association of Endodontics Glossary of Endodontic Term, they defined longitudinal tooth fractures as they are characterized by either incomplete or complete fracture line that extend through the long axis of the tooth. So the term longitudinal fracture is used because it typically represents a vertical extension of a fracture over distance and time. So these linear fracture tends to grow and change over time. So they have classified them into various types based on the separation of fragments, that is either incomplete or complete. So, in case of incomplete fracture, it occurs when the entire fracture is seen and the fracture parts can be moved without any dependence. But in case of complete fractures, it occurs when the entire fracture is not seen and the fracture part can be separated by an instrument. So the next one, on the basis of the severity of fracture from the mildest to the most extensive type, are the first one, that is the craze line, the second one, that is the fractured cusp, the third one, that is the cracked tooth, and the fourth one, that is the split tooth, and the fifth one, that is the vertical root fracture. So there are many challenges in longitudinal tooth fracture. First one, that is they are often misdiagnosed or undiagnosed for a relative longer time, and because they have a wide variety of clinical presentation from cracks to fracture, the diagnosis is less straightforward, as well as symptoms from this condition may be present for several months before an accurate diagnosis is made. So first one, that is the craze line. This craze line are generally located on the enamel only, commonly on the marginal ridge or the occlusal gingiva. So, the signs and symptoms are generally asymptomatic and then can be diagnosed with direct visualization or transillumination. And generally, there is no treatment needed until and unless aesthetic is required. And the prognosis are generally good in this kind of cases. So the next one, that is a fractured cusp. So in this kind of longitudinal tooth fracture, the location is generally on the crown or the cervical margins of the root, that is either mesodistal or labiolingual. While the sign and symptoms are they have a sharp pain with mastication and with cold. An identification of this kind of fracture is either visualization, bite test, transillumination. These are some of them. And the treatment is generally required to remove the entire cusp and restore them. And the prognosis is generally very good in this kind of cases. The next one is cracked tooth. These cracked tooth, the location of this kind of longitudinal tooth fractures are they are only on the crown or crown to root extension. Sign and symptoms are generally variable in this kind of cases, and identification and diagnostic tests are on biting test. We can do bite test, transillumination, staining with various dyes, wedging of the segments, and if it is unseparable, and under magnification we can check whether the cracked tooth is present or not, and whether how much is the extension of that cracked tooth. And the treatment modality for this kind of cases is root canal treatment, and it will depend on the pulpal and periapical diagnosis. And further, after that root canal treatment, we could go proceed for full coverage, cuspal coverage, that is for crown or onlay. And the prognosis are generally always questionable to poor. The next one, that is the split tooth. The location is from crown and root. Generally, it extends from crown to root. Extensions even though to proximal surface, and generally they are aligned to mesodistal direction. So the sign and symptoms of split tooth and cracked tooth is generally very similar. But there is a pain while mastication, that is on releasing the pressure. The segments may be separable. On we can see periodontal abscess, pain on biting, and identification and diagnostics test is the removal of the restoration. After the removing of the restoration, we can check or go for wedge test, or various dyes are present to check them. So the treatment are variable. So must remove one segment if the segment is there, restore or extract, and the prognosis is generally hopeless, or it may be variable. In cases of hopeless in case if it remains intact, and variable if the segment can be removed. So the last one, that is a vertical root fracture. Here the location is only on the root, that is only the root only, and generally at the labiolingual level, and the sign and symptoms are vague, and identification and diagnostic text we go for reflecting after reflecting the flap, and either with transillumination, and we can see isolated pocket or J-shaped radiolucency. And treatment is the removing the tooth or the fracture root, and followed by any fixed prosthesis or removal bridge or implant, and the prognosis is either hopeless or hopeless for this kind of cases.